At 87 years of age, Flo has been experiencing increasing sleep difficulties at least 3 times a week for at least 3 months. This has been interfering with her daily functioning. As such, Flo has been unable to concentrate on her daily chores and hobbies. Every night, Flo is unable to initiate sleep despite her best efforts. Even after falling asleep, she wakes up multiple times through the night. Eventually, she wakes up in the wee hours of the morning and is unable to get any more sleep. Unbeknownst to Flo, she has been suffering from a sleep disorder known as chronic insomnia.
A worldwide study in 2020 found that 49% of Singaporeans reported dissatisfaction with their sleep, with insomnia accounting for 28% of all sleep disorders. Another study found that 13.7% of older adults aged 60 and above reported sleep problems. Insomnia also leads to several negative outcomes including daytime drowsiness, fatigue, cognitive deficits, increased likelihood of accidents, reduced physical and mental health, lowered quality of life, decreased productivity and mortality. Individuals were significantly more likely to have a range of chronic physical and mental conditions including heart problems, paralysis, and depression. Elderly patients 60 years and above with persistent insomnia are more likely to develop major depressive disorder (MDD) and 3.5 times more likely to remain depressed even after treatment. Elderly women with insomnia are 6 times more likely to develop MDD compared to those without. Current methods of treatment of insomnia includes sleep hygiene, which are habits and practices that may contribute to getting a good night's sleep, cognitive behavioral therapy, CBT, which is performed under the guidance of a therapist, where patients are facilitated to change their attitudes and beliefs about sleep. This may include relaxation techniques, stimulus control, and the removal of distractions such as mobile devices. For medication, a variety of medication has been found to treat insomnia, however with varying effects. Antihistamines may become less effective over time, while antidepressants may be prescribed by doctors together with CBT.
However, such therapies have also shown to be insufficient in managing elderly insomnia in the long run. Hence, beyond the current mainstream treatment, our group wanted to focus on a relatively new treatment method called mindfulness-based therapy for insomnia, or MBTI. MBTI, like CBTI, is a multimodal, non-pharmacological-based program. The difference between the two is that MBTI replaces the cognitive components with mindfulness practice and education. The skills taught are to help patients learn to accept this sleep problem and in the process adapt to it by responding to sleep disturbances in appropriate ways, rather than trying to change their behaviors or force themselves back to sleep. MBTI usually lasts for 8 weeks, comprising of 3 main components that revolve around education and practice of mindfulness, above and beyond behavioral training such as stimulus control therapy. However, MBTI has its limitations. Firstly, there's a lack of public awareness and education, with many not hearing about the term MBTI, much less know about its efficacy. Next, there's a lack of accessibility to MBTI. Current MBTI programs are only offered in specialist sleep clinics or by psychiatrists and trained psychologists, as CBTI is the only multimodal behavioral therapy offered by government-run sleep clinics or hospitals. Thirdly, there's a lack of financial aid for MBTI programs, causing it to be costly and thus unappealing to the elderly to enroll. Therefore, we chose to partner up with National University Hospital Services, SingHealth, and National Healthcare Group to help enhance this program. With many polyclinics spread all over the city, all of which are located in easily accessible neighborhoods, would encourage greater enrollment. Additionally, with the help of such large healthcare institutions, it is possible to provide funding to further improve and grow the program. And with greater access to resources, there can be an increased outreach and MBTI advocacy to improve enrollment. With this partnership, we hope for MBTI to become a go-to first-line treatment for elderly insomnia, helping lessen the negative impact that this sleep disturbance brings to the healthcare system, caregivers, and society at large. Together, we can make MBTI a better tool for the long-term management of elderly insomnia beyond what is capable of by current treatments, helping tackle this chronic sleep issue. Thank you.